cerebrospinal fluid biomarkers that you need to take lumbar puncture, spinal tap, are now classical biomarkers. So they are on the market and in the clinic since many years, over 20 years in the most countries, and they are used especially in memory clinic setting. As I work in Sweden and I work with Swedish Dementia Registry, 90% of the patients from memory clinics in Sweden, they had these biomarkers done. However, it's not the same for other countries, and it's not the same even for patients from primary care setting.
Here in the United States, many patients and their care partners are very resistant to the idea of lumbar puncture. They see it as something not only very painful, but also really dangerous. And putting that in the context of somebody who has some memory lapses, may have mild cognitive impairment, they're not willing to, in any way step forward to take that step to get a CSF analysis because their perception, despite my counseling, is that the risk is much higher than the benefit, unfortunately.
Can I just add that other challenges then are on the systems level. So I'm in the state of Georgia. It's a very big state geographically, population-wise. I think there are 3 centers where someone could get a lumbar puncture if they were interested. So I think the barriers exist on certainly the layperson and the patient side in terms of their understanding their calculation of risks and benefits, but there are also quite a few system barriers, certainly in the US for health systems that offer it and practitioners that are trained and qualified to do the procedure.
Yes. Also in Japan, the CSF test is good because less cheaper test compared to the amyloid PET scan to check the age status. However, it's really bit invasive for patients, and also it takes more time for physicians. So it's really difficult to perform CSF in clinical practice. And also in Japan, some patients and family mistakenly think lumbar puncture is as a bone marrow test because in Japanese, a bone marrow test and lumbar puncture also have a similar same Chinese character, so a little bit confusing. So I would say it's very essential for us to have detailed explanation, performing a detailed explanation and communication with patients and their families.
It's our own perception sometimes, kind of the barriers in our own heads. It's how we communicate a lumbar puncture to the patient. Because if I'm confident that I can do it, I think it's not a very risky, not a very painful procedure. It's an outpatient procedure. And that's how I communicate it to the patient. It's actually quite rare that a patient will say no. So it's really about educating and training the clinicians, I think, is very important.